into the resolution that we called the special meeting for, that we need to discuss and review. And before we get into the public comment, I do have a letter that was sent to me yesterday. The physician could not be here, asked to have it read at this meeting. So I'm going to do that before we get into the live questions or comments. To fellow members of the Lebanon community, I want to offer some brief comments as we move forward as it relates to COVID-19. From a health system perspective, we begin to transition into the management phase of this epidemic. Case count and hospitalizations in the local area are declining, and it is now obvious that unmitigated, overwhelming disease within the community has been avoided. I have personally treated several seriously ill individuals with this disease. I can attest to the importance that everyone continues to make reasonable efforts to avoid contracting and inadvertently spreading this disease. Of an arbitrary selection of case counts, county or region lines, or various reopening phases for the local economy, we need to recognize that we must first be able to manage clusters of infections that will continue to occur in order to maintain some degree of control of spread in the community. In order to move forward, we must ask two important questions. Are we now capable of identifying almost all actual infections in our county? And is the disease activity in the county low enough to match available resources to manage clusters of further infections? It is my clinical observation and interpretation of the available information that the answer to these questions now appears to be yes. As we must move towards balancing the unintended harms these public health restrictions impose on members of our community. In favor of the county moving into the yellow phase, I have yet to hear a convincing argument or seen convincing evidence to do otherwise. Warm regards, Michael McCauley, MD, and he is a resident of Lebanon County. Okay, I guess we'll proceed. Jamie, do you have any thing to announce before we get into the public comment? We good?
You're on mute, Jamie. Jamie, you're on mute.
Thank you, sorry.
You're welcome.
I do have the resolution that can be read, so I'll take your direction on how you want to proceed with that. That's really the only thing I have. And
is it the board?
Depending on the.
Okay.
Is it your resolution?
Pardon me, go ahead.
Which resolution is it?
It was circulated to the commissioners individually last evening.
So it wasn't the one that you did previously.
No, there have been changes to it since.
Pardon?
It was modified slightly from the one that you received, I think, originally Wednesday to review.
So the one at 5:38 on 5/12?
No, this would have been last evening.
Okay, I have so many different. Can you read it? Because I apparently
he's
don't.
Going to read it.
Okay,
He's going to
I don't
read
have
it.
the final version then. I have two different versions, but not the final one apparently.
It was emailed last evening.
Yeah, I got it. Bob, did you want to put that up or send that to the participants? How would you like to handle that technology-wise? You're muted.
Yep.
Can we just have Jamie read it first, and then Bob can put it up?
Or at the same time.
Yeah. That's fine. Whatever the pleasure of the board is.
It can be done simultaneously.
Okay, well, we have a split decision on that.
Well,
Why don't you just read it, and then we'll put it up so everybody's listening to you, and then they can read it. But they'll have it in front of them.
Okay. Resolution 5/15/2020. Effective immediately, by this resolution, Lebanon County will operate under the yellow phase of the Plan for Pennsylvania, as put forth by the governor in response to the COVID-19 pandemic. Further, the undersigned Board of Commissioners of the County of Lebanon, Pennsylvania, declare that, effective Monday, May 18, 2020, county will expand publicly accessed services at the municipal building and some satellite offices on a limited basis. And whereas, while Lebanon County government services are being expanded, this resolution is not a binding or directive on any private sector enterprise that operates within Lebanon County. Limitations on businesses still exist at the civil and state level, and it is incumbent upon those businesses to know the risks, especially if subject to state-led regulation or licensure. And whereas, business conducted with Lebanon County government under the yellow phase must act in accordance with the following safety measures. Individuals must wear a mask whenever they are on county-directed facility grounds and/or while conducting business with county employees. Individuals must schedule an appointment with county departments for in-person transactions. Departments shall stagger appointments in a manner determined by the head of the department. Individuals entering county facilities must submit to medical screening procedures conducted by the Lebanon County Sheriff's Department or departmental personnel. Whereas Lebanon County residents have met the challenges set forth by the governor's original stated intent to mitigate the spread of the virus and to flatten the curve of the COVID-19 pandemic. Testing was increased to the highest percentage among surrounding counties. Our residents socially distanced, sheltered in place when asked. Businesses closed their doors. Our case numbers have steadily declined. Now it is time to move on together. And whereas the undersigned county commissioners empathize with the residents and business owners who wish to return to work so that they can provide for their families and to minimize the economic strain on their finances, while following established safety guidelines and continuing to work with the healthcare system to provide needed support in specific areas of the county that are still experiencing a COVID-19 onset. And now, therefore, be it resolved that the undersigned Lebanon County Commissioners declare that Lebanon County will operate under the yellow phase of the Plan for Pennsylvania while adhering to all established safety guidelines, and that together we will emerge from this pandemic with both our physical health and a thriving business sector.
Jamie, has there been any thought given to closing common areas like the cafeteria? I was looking at the VA hospital site this morning, and under their guidelines, they have 3 phases of opening. And one of the guidelines that caught my attention was closing common areas. And I thought, it just takes one person that's positive to sit down at a table and we don't catch it. And then it gets spread to others that sit there.
It's certainly possible. My thought toward that would be that certainly anyone being in that particular area you mentioned, the vending machine room, cafeteria area, would need to socially distance just as they would anywhere else. If they utilize a table in the room, there will be there's regular cleaning. Actually, escalated the cleaning back in March. So yes, it's possible to do that. It's also possible to do signage that would remind people to do all of those other things if they're in that room. But
and is there hand sanitizer and things in the cafeteria?
I
We
don't
can
know
make sure there is.
offhand, but we certainly could. I mean, we've got some supplies for the employees. We can make it available right there at that counter. Sure.
My suggestion might be that we just put a sign up that it is not available to visitors, employees only. I mean, that's we're trusting them to be in the building and moving among us. Why wouldn't we entrust them to be prudent in the cafeteria? But I wouldn't extend that to visitors. That's a suggestion. Okay, anyone want to talk about modifying the resolution, or is there do we want to?
I would like to make sure that something about the common areas is included in the resolution, whether it goes through or not. When we do open, I think that's very important. And also about having proper hand sanitizers throughout the building.
Would you like me to send out this link at this point?
Yeah.
Yes.
Yeah.
For anybody attending, in the chat window, there is a link where you can view the draft resolution. It's a shared public link.
Okay. Bill, do you have any opposition to adding hand sanitizer language? And
I would have no problem with doing that when we have a motion to have that included in the motion. I would suggest that Commissioner Litz make the motion and include those items that she wants, and Jamie can record them and have them included.
I'm not interested in making the motion, but if it does go through, I think it's important that we consider the common areas and the hand sanitizers.
Can the county administrator just make note of those things and have them included?
mute,
You're
Jamie.
mute again. You're on mute, Jamie.
Mute.
Mute.
That doesn't work when I have the chat box up there. Yeah, I'm going to just come up with an additional bullet point to that. In the meantime, I'll have something for you by the time you're ready.
Thank you.
Do we want to take public comment first, or do we want to put a motion on the floor and then use that as the discussion time?
We can put a motion on the floor if you want to.
Okay.
I'll make a motion to adopt the resolution as printed with an additional bullet point to be disclosed before we vote.
Is there a second to the motion to have discussion, public input? Is she muted or no? Okay, well, in the absence of a second, I will be happy to provide that motion. I think it's important that we hear from the public on this important issue. So I'll
So the commissioners comment first and then go to the public. Isn't that protocol?
Sure, you may speak if you'd like to be first.
I will gladly go first. Again, I feel that I wanted to re-emphasize that slow and steady, like the tortoise and the hare, is more important than rushing out of the gate. We have been making progress, but we're not out of this yet. I did study some charts given by Tom Harlow. I found them in an email this morning. However, what I noticed was that it ended on 5/11, and the next day we had 10 new cases, which was 5/12, and the following day we had 24 new cases, which was 5/13. And again, yesterday we had 7 new cases. That's 41 new cases in only 3 days, and we have 4 days left in the week. So we are not going to be below. And we also increased deaths from 16 to 19. So we are not going to be below the state threshold. We are under a governor's mandate, like it or not. The Supreme Court has said that his ruling and his executive order is valid. So we do need to follow that. And to push this through before we are in the correct zone by the state is going to be confusing and misleading to the public. This morning, I also noticed that the Chamber of Commerce put up all of the different, it was over 200 licenses that the state issues that could be in jeopardy if people open. We don't want to send a mixed message. This should not be political. This is a life and death issue, not a Republican and Democrat issue. We need to do the right thing, and the right thing is to wait till the end of the month or June 1st and then look at this again. That's about the time that was predicted from the very beginning that we would be out of this thing. And things will turn the other way. In 14 days, we're going to have an escalation if people decide to open prematurely. Then it'll go another 3 months to run the cycle again. So I really beg you to reconsider this move at this time.
Are you suggesting, Commissioner Litz, that we shouldn't open the courthouse then?
At this time, correct. Even the judge is not opening other than for emergencies until June 1st. That is that was established some time ago. We reevaluate this every couple of weeks. And so to have part of the courthouse, and maybe in the resolution, there should also be something that says no more than 50% of our employees can be on site at the same time, again, to allow for social distancing. That's another part of some of the other guidelines I've seen to give guidance to the departments. I just think it's being rushed and it's premature, and we should keep the courthouse in consistency with the courts, which would go till June 1st.
Bill, do you have anything else?
Well, just in response to that, I think, I don't know if Commissioner Litz has reviewed the plans that have been provided by the department heads and the row officers, but they address the staffing issues and things like that in their plans that they put forth. And just as a general comment, I would like to say that I received obviously many comments from the public, and I appreciate those, and both pro and con. And I thought a few times my phone was going to melt down. I tried to respond at least with a thank you to every one of those. And I would also like to say, just as a general comment, that some of them were very strong, and at least one pointed out character flaws of all three commissioners. But I would like to say that I would like to apologize for any character flaws that I revealed or will reveal during a public meeting. I apologize for those. I will definitely work on correcting those, and especially today. So with that said, thank you.
All right. Mr. Dowd, if you'd like to start bringing in the public comment, we could start right now.
Hi, good morning, Commissioners. I personally, on behalf of myself and virtually every resident of Lebanon County and some from other counties, want to thank you for your leadership and your courage to move us forward. And I don't want to repeat what most of the medical people have said, but I'll be about as direct as I can be. Number one, there are no metrics to support the continued lockdown. The CDC data, average age of death in Lebanon County is 84. 2/3 of our cases are coming out of nursing homes. There are virtually no pediatric cases, and the younger people that have had deaths have almost exclusively had significant comorbidity. The most at-risk population has been the population in nursing homes, which has been failed by Governor Wolf and Secretary Levine, who I note the hypocrisy with Secretary Levine pulling his mother out of a nursing home while allowing others to simply die. There is simply no reason at this point to keep the county locked down. The other things that we don't know is how many people have already been exposed and developed immunity. I suspect that's a very high number. When we look at other states, and we heard the same thing, it was 3 weeks ago that the state of Georgia opened. It was the same prognostications, too fast, lots of deaths. Look at Georgia. Georgia opened 3 weeks ago with 650 cases. They have about 500 today. We've not seen that. We've not seen that in Florida. We've not seen that in the other states. We have Governor Wolf conspiring with other Democratic governors to delay the reopening as long as possible. It's become purely political. And I'm here to tell you that to a person that I talk to on the street, that I run into, that's the unanimous consensus. It doesn't make sense. The restrictions simply do not make sense. And what is happening is small business is being eradicated. The large companies are open. For example, Jono hardware is closed, Lowe's is open. All that's going to happen is the big companies with the money, who ironically are open and making money, are going to swoop in and buy up, for example, the liquor licenses when your restaurants fail. They're going to put the mom and pop out of business, and mom and pop drives this economy. You want a recovery, we need to push it down. Top down doesn't work, bottom up does. Push it down, cut the taxes, cut the regulations, and get the county working again. That gets the state working again. Governor Wolf's threat is really all that. It's a threat. It was very weak response, which is based on, here's the snitch line, call in, we'll take your licenses. Number one, he doesn't have that ability directly. In many cases. Number two, it's self-defeating. Lebanon County net exports tax dollars. I suggest to you that if he wants to threaten us that way, we need to tell him, how about we will hold our taxes? We'll hold our real estate transfer tax. We'll hold our inheritance tax. We'll hold our fine money. We'll hold everything else that we send out of here. Because I guarantee you, on the whole, we send more out than we get back in. And gentlemen, we would not have this debate at all if the numbers were there, if the metrics were there, if people were really getting sick and dying in great numbers. We wouldn't be having this meeting. We would all agree. Everyone knows what it is, which is nonsense. America did what America does. It buckled down when this came out. Everybody closed down. We were told 30 days, flatten the curve. Hospitals are laying off nurses and doctors. Wrap your head around that. If the goal was to flatten the curve, that goal has been accomplished weeks ago. And you'll recall back in April, they're lying about the numbers. When Pennsylvania had 286 people come back to life, I think it was April 23rd to April 24th, because everything was coded as a COVID death. So not only has Wolf failed, and he's failed our most vulnerable populations in terms of the elderly, he's failing small business, and by lying on his numbers, he's going to make it that much more difficult when the next one comes around. With no pun intended, Wolf has cried wolf. And mom and pop need to be open. It needs to be driven from the bottom up. Mom and pop run this economy. All we're doing is helping the big guys. Helping the big guys. And one last thing to any veteran out there, I take particular umbrage at Governor Wolf referring to anyone in Lebanon or Lancaster counties as cowards. That gentleman broke the law by being a draft dodger, and he offends everyone who served in the military. He should be embarrassed. And quite honestly, if they want to say you're going to have blood in your hands, Secretary Levine has blood on his or her hands, whatever you want to call them. I think we should investigate. If any of those deaths were in Lebanon County, whatever the applicable crime is, manslaughter, take your pick, reckless endangerment. Gentlemen, stay strong. Governor Wolf is a bully. Treat him as such. Let's move forward, because you know what, gentlemen? Everybody knows it. Everybody knows it. You have been the rallying point. I have had calls from clients in other counties. I don't know why they call me, calling me to thank me for Lebanon County leading the way. Lebanon County decided the last presidential election. You're leading the way. Stay strong. Pass the resolution. Let's move forward. Godspeed.
Thank you, Tony. Okay. Our next caller, please.
Good morning, Commissioners. This is Katie Abram. I'm speaking on behalf of my husband, Sam, and I. We've had a business in Lebanon County for over 40 years. It's family owned. We definitely appreciate the due diligence that everyone in our county has gone, and done to help flatten the curve. I know this has been terrifying, especially in the beginning. Our kids didn't understand what was going on, and it's definitely been an interesting couple of months. It's been wonderful to see everyone to come together. But with that being said, I think it is very clear that somewhere along the way, a number of people have forgotten why the stay-at-home order was put in place. It was not in place to keep everyone from getting sick. It was not in place to keep everyone from dying. It was, in fact, put in place to keep our healthcare system from being overwhelmed. So the question I'd like you guys to keep at the forefront of your decision-making is this. Number one, has our healthcare system been overwhelmed here in Lebanon County? And number two, is it currently overwhelmed? If not, then the answer is clear that we need to have the option to reopen. Now, I know there's a number of business owners that don't feel comfortable opening. So be it. Give us that opportunity and that choice to be able to reopen, to service our customers in a way that makes them feel safe, that keeps our family safe, if that is something that people are worried about. But the idea that we were summarily told that we had to shut our doors and lay people off. I know a number of business owners in this county who, the day after this was put in place, they laid off numbers of people in this county. With that being said, you know, I know a number of business owners who have also applied for the PPP loans. It has been extremely difficult to obtain the PPP loan for a number of people in this county. We were fortunate enough that, you know, with the second round, we finally got it. But, you know, not everybody is privy to that. So what happens to those business owners? What happens to their families? They are not bringing in money that they need to. Whereas, like Tony had said, we have Home Depot, we have Lowe's, you know, people are waiting in line, spending money. Everybody else needs to have that opportunity. So I go back to, is the healthcare system being overwhelmed? If it is not, then the business owners of this county need to have the option to reopen. Thank you all for your time. I greatly appreciate having the ability to give the input. So thanks, guys.
Thank you,
Thank
Katie.
you, Katie. Commissioner Phillips, Davis Shaver from the Lebtown is asking for the spelling and pronunciation of each name. Apparently he's a call-in and he can't see the names on screen. So the first one was Anthony Fitzgibbons and the second one was Katie Abram.
Yeah, if people could just simply state their name. The second thing is there are a few people in the chat who don't have a microphone on their computers, and so they're posting a comment in the chat if you wanted to go over and be able to see those. Just wanted to mention that.
Okay. Anything for Davis? Next.
Tom, your microphone's on mute.
Sorry about that. Good morning, Commissioners.
Morning.
Morning, Tom. Tom Morrison.
I would like to thank all the commissioners and to Joellen, you're correct. This should not be a Democrat-Republican thing. I would hope we can be united on the fact that the fear is dictating a lot of what people do and say, but the reality is that we need to get open again. You mentioned, Joellen, about being slow and steady. This has been for over 2 months. I'd say we flattened the curve, and we're not looking to open everything without following CDC guidelines. I think the governor's orders have not been consistent by any means, but we need to, if nothing else, send a message that we are going to continue. The ironic thing of him calling people cowards is staying at home, and everybody's entitled to do that, is not courageous. Courageous is not being stupid either, but we need to move forward before we totally decimate our whole economy and our way of lives. The issues are real, but the numbers don't support the actions. So I would call on all three commissioners to lead and not follow. You know, whether it's setting example, or not.
I think we lost him.
I was going to say, I didn't know if it was my computer or his.
Tom, we lost your sound.
I think we can come back to him if he wants to recall. So go ahead.
Family Fun 2020, we need your name.
I'm sorry, is this me?
Yes.
Wow,
This is you.
I didn't realize, I can't believe it came through that way. That's really odd. Anyway, I have no idea why my name is not there. I'm sorry, this is Ann Pinka.
Say it again.
Ann Pinka, and I'm a resident of Lebanon County,
Is that
lifetime.
Pinco?
Pinca.
And Pinka.
Yes,
Oh,
you all know.
Pinka. Oh, I understand. P-I-N-C-A, Pinka.
Yes.
Okay.
Yes. So first of all, thank you for allowing public comment during this meeting. I hope you all received my comment that I sent to you yesterday. So I'm not going to repeat everything I mentioned in that, but there are two things I really wanted to ask. And the first one was for the commissioners in my comment was, what is the plan should the virus skyrocket again? I didn't see any sort of plans to deal with that. Should we have a huge, overwhelming rise in the virus? And how will you put a lockdown on again? And if you've already sort of opened the gate to disobey that lockdown rules. So I have a real concern about that if that should happen. So what is the plan for that? That was my first question. And my second question, unfortunately, was for Solicitor Warner, who seems to have dropped off of the call. At least I don't see him as if he's still there. I really wanted to know, there he is, okay. I really wanted to know his legal opinion on passing, on the commissioners, if they choose to pass this resolution, what the legal implications would be for passing a resolution that goes against the advice of the. So those were my two questions.
Okay. I'll take the first one, and Bill, you can, and Joellen also, that if there is any, we watch these numbers every day, and we get feedback from the hospital, we get feedback from other healthcare practitioners. If you look at the inside UPMC testimony that was given by Drs. Yaley and Shapiro, I think that gives a comfort level that if people stay with what we've been practicing, and that the social distancing and all the best practices, keep an eye on this. If there is a resurgence or an uptick, then we're going to have to reconvene and discuss that further with the medical professionals.
So, and you would consider locking down if a certain level is reached, and I wonder what that level would be.
I'm not at a position to put any, or to take anything off the table.
Okay,
And I think in almost all cases, even at the state level, the recommendations always come from the medical community, and politicians don't make those recommendations, or office holders don't make those recommendations. So I would, as I always have been, be willing to allow the medical folks that are the experts, should there be a resurgence or an uptick, certainly to listen to their recommendations.
Well, that's an interesting comment, because I read Stephanie Andreazzi, who is a doctor and the head of the ICU at WellSpan. Who doesn't think that we should be reopening early, was my interpretation, because she sees firsthand the devastation that this virus is causing. And on top of that, I know, I think it was Anthony might have mentioned, or one of the fellows mentioned about the change. And I heard professionals on the news last night talking about this. And the novel virus, and novel means new, and it evolves. And so that's why there has to be flexibility and change as time goes on. Also, Dauphin and Schuylkill counties reviewed all of the liabilities, as was asked by Ann Pinka, and indeed, when you review that, it's not worth the risk, because the liability on the county, our insurance carrier, is not necessarily going to cover us, and that makes, I mean, it could cost a lot of money, and that could result in a tax increase. And of course, the loss of licenses to the individual businesses that are with the state. That's another thing. And finally, there was a statement made that I think that was Tony as well, that Jono hardware is not open, and that's not accurate. They do have drive-up service. You call in your order, it gets filled. So you can shop at Jono, much like the restaurants. They bring it, I guess, out to your car. I'm not sure exactly how a transaction goes. I wasn't there personally, but they are open is the point.
If I could just respond, and without in the least bit wanting to be disrespectful, Commissioner Litz, you had no problem exposing the county to lawsuit when you attacked Cedar Haven and the owners of Cedar Haven for about 3 years. And folks wouldn't know this, but we received a letter from the owner of Cedar Haven threatening lawsuits if you didn't stop that. So you didn't have a problem exposing the county then because it was your agenda. Now you think we shouldn't expose the county to any legal position. So, you know, it always depends on where you're coming from as to how this should work.
In rebuttal, Commissioner, I didn't bring up the topic on Cedar Haven. It was brought up by one of my colleagues, and I responded, or it was asked in a debate question because we were all running for re-election. And I did respond, and I responded truthfully and with the information that I had at hand. And I never attacked anyone individually. In fact, I delivered hundreds of masks to Cedar Haven to help the staff there. So, you know, I have no problems with Cedar Haven. I just responded to the questions that were asked.
Okay, let's get back. My only comment about the money part, I'm not trying to focus on the exposure that we are entering into with the governor's threats of not giving us the federal money and those kind of things. And whatever else he would be empowered to influence, it could be money for rail trail, or it could be money for, you know, any number of grants that we go for mental health and, you know, victims' rights grants and so on. Those are all things that are unknown. But I'm trying to, with that in mind, I'm trying to focus on the societal and economic and balance that with the risk. The isolation of people, the depression, alcohol use, drug use, the housing and medical sectors, the retail sectors, all these things have to be considered, not just the financial. And so that's part of my equation. And if you Google inside UPMC and watch that testimony of Dr. Gieli and Shapiro, it clearly states with their $18 billion health system and their 50 or 40 hospitals that we should open the state and put a circle around Philly. Don't open Philly because of the density of the population and other issues there. But the rest of the state should be able to get out of the isolation, because the effects of keeping us locked down will be long after this virus, is what they're saying, in the repercussions, both in the economic repercussions and the isolation and the mental health issues that will follow. So that's where I'm trying to weigh the threat of the loss of the money. But if the governor would take out his wrath on 140,000 of our citizens for our actions today, I'd ask for his mercy for them. But we're trying to do the best we can for the population that we were elected to serve, and that's how I've come to my conclusion. Are you finished with your comment?
No, with all due respect, I feel like I didn't get a very clear answer to what parameters or metrics will be used for another lockdown is in place. And I'm just going to throw in the comment there that by increasing the viral circulation in the county, you are condemning a lot of people who are vulnerable to being exactly that, locked down in their homes, which includes my 94-year-old mother with some health conditions. So there is a certain population that you will be impacting greatly if you allow this virus to expand farther. But again, I don't know how you would lock things down again if you have this resolution in place. I guess you said you'd meet and pass another one, which I think would be difficult to do. But I would definitely like to still have my question answered to Solicitor Warner on his legal opinion on the commissioners passing this resolution and the vulnerability of the county as a possibility of that, if he is able to answer.
Commissioner Phelps, would you like me to respond?
Yeah, go ahead.
Thank you. Yeah, so we have to kind of start with the analysis. I've kind of previously stated this already, but we recognize in the resolution that's contemplated here in the pending motion that the county has certain authority, and the governor, or at least the Department of State under the executive branch of the government, has certain authority as well. Certainly the county government is not authorized under statute to issue licenses or regulate certain licensed professions. There's nothing we can do within our powers to regulate, like in the various licensed professions across the Commonwealth that are overseen by the Department of State and the various licensure boards underneath them. Again, what the county government can clearly control is the operations of county government, the functions of county government itself, all public offices that are owned and controlled and operated by county government. So there is some distinction there. As to the resolution itself, we've heard the governor's response, at least in a press conference, and indicates that he may take some steps. I think, again, we haven't officially acted yet. I think it will depend what the final version of the resolution is. And if the governor chooses to direct any portion of state government to respond accordingly, we'll have to evaluate what that is. It's still a little speculative for me to tell you what those consequences may be. I have discussed with the commissioners certainly the idea and the understanding that the governor is making these statements, and then we can analyze that and determine if there is any additional risk to the county or not, or what the potential for those outcomes would be. But again, until the governor actually acts or directs a department or agency under his discretion to act in some way, it's hard to make that determination.
Well, thank you. But isn't it true that the commissioners go with your legal advice as the solicitor on whether to pass a resolution or not that is in the best interest of the county? I guess that's the point I'm trying to get to.
Well, I think the commissioners in the County of Lebanon are my client, just like any other client would be. I respond and answer to questions and provide legal guidance, in my opinion, and they act as they see fit in their best judgment and interest on behalf of the county.
May I make a clarification? I see here, I believe it's Dan Sedelnik, but I know there's more than one, so I'm not 100% sure. But he says, as I listened to the resolution, I thought I understood it stated that the county offices were opening in the yellow phase, but the citizens are still following state guidelines, which are red. Can you please clarify? And I think this interpretation is correct.
Okay, I'd like to finish up with Dave and Ann, and then we can address Sedelnik's question. Are we finished?
Okay. I guess the answer, what I'm really wanting to know is whether he is recommending this resolution be passed or not to the commissioners, but I realize that may not be in the realm of something he can answer. So that is really the essence of my question. If that can be answered, fine, and if not, I understand that that's client attorney privilege question, perhaps.
Okay.
I believe I've answered the question as fully as I can.
All right. Well, thank you very much. I appreciate your answering my questions.
Someone brought up something with Attorney Sedelnik, I believe it was, or I'm not sure it was.
I'm not sure which Sedelnik it is. It might be the father.
Yeah, I think
it
says Daniel, not Nicholas.
Does it? I couldn't see a first name. Yes,
Okay.
the point is that the resolution is to open the courthouse and that businesses are still in the red zone, according to the governor's order. We have no authority to tell businesses that they're in the yellow zone, is what it's saying.
Thank you. Next.
Good morning. My name is Dr. Angela Hoover. I am a resident of Lebanon, specifically in Cornwall, Pennsylvania. I am an elementary principal, and my husband owns his own dental office here in Lebanon, which many of you may be aware of, Dr. Brett Hoover. And my question for the panel this morning is, as you begin to open up the county offices and your municipalities, and you're bringing your citizens back to work in your house, what conversations have been taking place with our local daycare centers so that you can bring back your employees, and those employees will have appropriate childcare available to them? I know that is a big concern with a lot of, not just you at the courthouse and the municipal buildings, but small businesses as well. They are struggling with, yes, we want to really reopen. However, what am I supposed to do with my children? Schools are closed up through the end of the year. Daycare is currently closed. I would like to know what types of conversations you've been having regarding this particular issue, because this issue, even though my husband's dental office and practice was able to open its doors, this is a problem that he actually continues to struggle with his current employees, because the dental office needs to run. People need to be cared for with their health. Other medical professional offices need to open, and they need to have their staff there, but we don't have the appropriate care for our children. Is there any way that this is being addressed, and has this been on your radar? Thank you.
I could speak to what arrangements we've made with our employees at the courthouse, which probably would not apply to your situation or a lot of other folks in the county, but we have allowed folks to work on varying schedules and so on, so that they can manage their child care and also be available for work. I think there are a lot of unanswered questions about the daycare centers that haven't been answered at the state level by the governor and by his Secretary of Health. So it certainly isn't something that we could intervene in and solve the daycare problem.
May I add, Commissioner, that perhaps we should be addressing that somewhat in the resolution, that we will utilize people who can still telework or work remotely, however you want to phrase it, so that till we get through to the green zone. That way it would solve the childcare problems for them.
Well, I personally assumed that we would move forward with that because we've been doing it since we closed the building.
Right,
I would
but I
highly
think it needs
recommend
clarification.
Correct, Commissioner Litz. I agree with you. I think this needs to be in writing for the public. If you are going to put out this public document as to what you are going to be doing at the county level, that would help to guide the directive when other small businesses do begin to open their doors. They would be able to follow your lead. Mr. Ames, you talked about having the rotating schedule, the flexible working hours.
Mm-hmm.
You talk about telework, people being able to Zoom in that are able to do so. Those are things that we are currently doing in the realm of education, as well as my teachers. They're all working from home, taking care of their children and their families while still trying to provide an education to our children of Pennsylvania. So I do think it is really necessary and critical at this point of the stage of this resolution that wording is put into this document. I completely agree with what you're doing. I think our community needs to see that our commissioners are moving in the right direction. You're not forcing anybody or any small business to open their doors. You are simply providing the means to getting this county back up and running as it should be. Lebanon County runs and thrives on small businesses. We've seen the impact that this has had on every single small business in our county. And I congratulate you on the steps that you are taking. I support your resolution. I just do think you need to add a little bit more depth to the resolution so that you can pave that way for the rest of the small businesses in the county to reopen in the same manner that you are going to as well. Thank you very much for your time today.
Thank you.
Thank you, Dr. Hoover. The only thing I would add to that from my conversations would be that some of the daycare centers are not going to be reopening for fear of their licenses. Some are going to take a chance because they are going to be out of business if they don't. So those are the choices that people are being faced with as employers or as runners of those kind of businesses. And the thing I would add would be that District Attorney Graf has said that she will not prosecute locally anyone who opens up and is in those categories of non-essential or however they are deemed right now with going into the yellow. But that's not a guarantee that the state will not come in and do something that would be disruptive to their business and to them financially. That we cannot say. So everybody, that's why this is a personal decision for everyone, but at least it gives people the idea that, hey, we're getting our rights back to decide for ourselves to take a chance or not to, or maybe they don't have the choice because they're going to be out of business if they don't move in that direction of reopening. So next call.
Hi, this is Jesse Rothacker. I'm from Lifeway Church, which meets at the mall in Lebanon. And on May 31st, we are going to ignore the governor's recommendations and we are going to reopen the church May 31st. And I would remind all churches that they are exempt from the governor's order, so they can ignore his recommendations legally to reopen. But I also belong to some organizations that work with youth. I belong to the Lebanon YMCA, and I have done work with the Lebanon School District after school programs. And I would like to remind everyone that out at youth risk are at higher risk right now in the shutdown because we continue to close down the places like after school programs, like the Lebanon YMCA, like rec center programs, even playgrounds, basketball courts, and a lot of the healthy things that children need and our youth need when they're at risk. Right now, the Pennsylvania State Police says domestic abuse calls have more than tripled. The World Health Organization just this week said it may be 5 years until we get this virus under control. And I would just like to mention that we cannot wait 5 years for our at-risk youth to have safe places to go. Our youth are at the lowest risk of the virus, and many of them are at the highest risk of the shutdown. Currently in Lebanon, we have many places like Dairy Queen, Rita's, Taco Bell, and Dunkin' Donuts that are considered essential. And to be honest, I consider a taco as essential as the next guy, don't get me wrong. But if we can have Taco Bell and Italian Ice and McFlurries all essential, I think we need to consider it essential to have safe places for our at-risk youth here in Lebanon. The people of Lebanon are a free people. I live near the Lebanon-Lancaster line, and I just want to thank the supervisors for your leadership, because the Lancaster County Commissioners originally were backpedaling, saying they would not ignore the governor's orders. And I've never been more proud of Lebanon when Lebanon went first to ignore the governor's orders. And within days, Lancaster County followed Lebanon. So I want to thank you guys for your leadership. But I want to remind everyone, as the free people of Lebanon, we are free to make our choices. And I support the right of people who wish to stay home. And I would remind them that their choice to stay home does not affect my choice to return to work. In fact, I encourage people who want to stay home as long as they like, to stay home indefinitely. And if they're following their own advice to stay home, then my choice to leave my home and work and feed my family and help the youth of our county is of no consequence to them. I would also remind them that if they truly believe staying home is the answer, that Giant, Amazon, and Walmart all deliver. So you guys can stay home as long as you like. and let other free people like us to make our choice. And I want to leave with one sentence from the Declaration of Independence, which says, "Governments are instituted among men, deriving their powers from the consent of the governed, that whenever any form of government becomes destructive of these ends, it is the right of the people to alter or to abolish it." Commissioners, I agree with you that our Governor Wolf in Pennsylvania has become destructive, and I want to thank you and implore you to consider altering and abolishing his edicts and his orders that are bypassing our local and our capital elected legislators. So please continue to do what you believe is right for the county. I believe the right thing for the county is to cautiously and safely reopen immediately. We cannot wait any longer. Thank you very much.
Thank you, Jesse.
And would you please, when we get the call, identify yourself so that we will know who you are if it's not available for some people's instruments.
Chris, your mute button is on. There you go.
Okay, Chris Coyle from lebtown.com. 3 real quick questions about Dr. McCauley's letter that was read by Bob. Number 1, what is the date of the letter? Number 2, can we get a copy of that? And number 3, what is Dr. McCauley's affiliation, such as hospital or medical group? That's all I have.
May 14th is the date on the letter. I cannot circulate permission to anyone. And the reason that he asked to have it read was that he couldn't be here and didn't want his affiliation made public.
Okay, so May 14th letter. Oh, I'm sorry.
He may be willing to share that with you, but I am not at liberty to share that information.
Okay, so May 14 letter, and the letter cannot be shared, and his affiliation, if any, cannot be shared. Am I correct in the understanding? At which point I'll shut up.
No, you're correct to this point, but I will be happy to. I don't know Dr. McCauley, but I will follow up with him to see if he can connect. If I can give your phone number, you can talk with him and see where he can go as far as disclosures and giving you a copy.
I appreciate that. Is he based in Lebanon County, if you know?
Yes.
Okay, that's all I have. Thank you.
Commissioner Phillips, wouldn't that fall under right to know if you received a communication that he would have a right to a copy of that?
Well, if Chris would like to file a right to know request, that's another way he can do it, but I'll be happy just to call Dr. McCauley or follow up with an email and see if we can just do it that way. But whatever, I'm assuming that it's, not a big deal to communicate with him.
Ed Madden here with PA Post WITF. Thank you for taking questions. I just want to make sure I'm clear. Is this resolution symbolic for businesses? And is the resolution specifically what you have control of as county government, and for the rest is symbolic? And if so, I just if you can speak to why that is.
I think the reason it appears to be symbolic only is because the county commissioners do not have the authority to override really what the governor has set in place. So we are seizing the opportunity of, while we're opening our county facilities, which we have legal stance to do, we are also taking the opportunity to communicate the importance of opening our businesses and the economy in the county. But we have made it clear from the outset, and even in earlier discussions, that we're not authorizing businesses to open. We are standing up as an example of how it should be done with our county offices.
And so just to follow up, and so you see that this resolution as a way of, telling businesses that they are free to open if they are comfortable doing so, starting now?
Yes, I would say so.
And that the local district attorney has said that she will not prosecute folks that do open.
I'm unmuted now.
You are.
Yes.
Everyone, thank you for your hard work on this tough issue.
Would you please identify yourself first? Thank you.
My name is Diane Ferguson. I am a retired nurse and professor of nursing, and I live in Ono.
Thank you.
Yes, I am a member of a sewing group making masks and personal protective equipment. I know that our group is getting lots of requests for making isolation gowns and masks from nursing homes, from hospitals, from the public. And I'm wondering if hospitals have the necessary PPE to address an upsurge, considering we are still getting desperate requests for those masks. I'd like to make sure that we are ready for an upsurge or even a second wave. I also was concerned about what Ann Pinka had said, what would be the indicators to return to red, considering we are already considering ignoring the CDC guidelines about the threshold. And we have over 3 times the cases that the CDC is suggesting would be okay for opening up. And the third thing I'd like to say is that when I went into Jono hardware store the other day, into the store for normal business, it was totally surprising to me to see that while people had masks on their bodies, they were hanging around their necks, on their chins, not on their noses and mouths. And I really do think that there should be a lot more effort to do public education as far as proper mask wearing, not only in Lebanon County, but generally. Thank you for all you're doing. That's all I have to say.
You're welcome, Diane.
I will, in response, or at least to tie in with what was just said, if this is passed as a resolution, and even if it's not, we do know where the hotspots for new cases are coming from. And the goal would be then to communicate with the Community Health Council and other groups that can, Family First, Welsh Mountain, Volunteers in Medicine, all that deal with populations of the vulnerable folks, and focus on those zip codes, primarily 17042 and 046, to really pound them with education and communication to give this the best chance of continuing. Now we're 8 weeks into it, so it's assumed that people are aware, and but we're just not making a lot of headway in those 2 zip codes that we think we should be. So that's a hot spot, I think, that we should work on, and maybe some businesses that are showing to deal with the owners of those businesses if they're getting an upsurge in cases. But those are things that we can do proactively to prevent a resurgence. Next call. Yes.
All right. Thank you all for conducting this meeting and allowing me to participate and express my thoughts. And I'll keep it brief. And I think a lot of the thoughts that I hold have been expressed already by a number of the callers. We need to allow the citizens of Lebanon County to make decisions for themselves. All right, we have guidelines that they can follow, but that's what we need to do. All right, we need to not just get the courthouse up and running. We need to allow business owners. We need to allow employees. We need to allow everybody who wants to get back to work in a safe manner to get back to work in a safe manner. All right. COVID is not the only issue we have out there right now, because forcing our entire county to shelter and stay home and not work and not take care of their families is every bit as dangerous, and then some, as the COVID virus is. And we've got to take a strong stance and say, we need to do the right thing for our entire community. And the right thing is to allow our citizens to safely get back to work. For those that don't feel that that's the best move for them and their family, they're perfectly at have the right to not go back to work. You know, they can stay home if that's what they feel is best for their family. But, you know, again, looking back at the testimony from the doctors from UPMC, a world-renowned facility is telling us that the majority of Pennsylvania, other than Philadelphia, can safely go back to work if they do it the right way. And that includes Lebanon County. All right, Dr. Shapiro, and this was referenced by Commissioner Phillips already, so I won't spend a whole lot of time talking about it, but Dr. Shapiro and his colleague testified in front of the Pennsylvania State Senate, the Committee on Health and Human Services, and told us this. Other than Philadelphia, Pennsylvania can safely work and operate if we follow the recommendations and the guidelines of the CDC. And again, if people don't choose to do that, that's up to them. But people should have the right to get back to work if they choose to get back to work. So again, like I said, I didn't want to I had a lot that I wanted to say. A lot of it was already said, so I don't want to just repeat what other callers have said. But I fully support the rights of Lebanon County residents to get back to work, to get back to living their lives under the correct guidelines from CDC and the other experts that have put in place. So thank you for allowing me to speak on this topic. And like I said, I wanted to be brief, but we need to get all the county back with the option to go to work if they choose to.
Commissioners, Randy Ebersole here, and fortunately we all know each other, and that adds to the comments. And I'm going to contain only the comments. I think that's what you're looking for. I'm not going to drill you on questions or try to get you to pit against each other on particular subjects. But I want to make sure anybody that's listening, I represent a 100-year-old company that has done business in Lebanon County all of those years. Fortunately, I'm third generation. The company is now managed by fourth generation. And I want to just thank God I was able to work every day in March, April, and May so far. And I just want to say that we are committed to our employees and our customers, as well as many other companies that are. And when I say we're committed to our employees, yes, we take the measures we need to. We are doing the protections that are recommended. And we are looking forward to them all continuing to enjoy good health. But we're also committed to our customers. And fortunately, we had a service department that could take care of customers that needed our help for over a 5-week period. However, we were closed. We could not sell one car. Millions of dollars sitting on every dealer's lot, and they couldn't do a thing with it. Fortunately, we can now do it under their standards. But during that period, we had customers that had total losses, and they had major breakdowns, and they wanted another car, but we couldn't sell them to them. So in our minds, we were not able to be of service to the customer. So actually, you can hear I'm a little upset about just the fact that we were on hold. We're now able to open, but I wanted to call and tell you, I support you commissioners, and I know you. I know your background, and I know your abilities, and I have total confidence in you that you can make, I'm sure you know the answer to all these questions people are going to ask you, and you will make the right decision. And I am proud that we have county commissioners, we have a district attorney, we have a senator that has the courage and the strength, courage and strength to take action that they're going to be, hopefully be taking. Now, before I go too far, I hope you don't take my recommendation and my endorsement of your actions lightly. I want to tell you, I'm 65 years old. I've been diabetic for 25 years. I'm one of the top people to be susceptible to this. And I have a family, fortunately, of an entire family, 6 families that represent 20 grandchildren that are right here in Lebanon County. And I don't take this decision lightly. I'm concerned about myself. I'm concerned about my wife, my kids, my grandchildren. But when I weigh it and I see where we're headed with a disaster of the financial burden that we are going to be putting on our grandchildren and great-grandchildren, I conscience cannot continue to live under the rule that we have lived under. And I don't think there's a lot of people, and you say, well, yeah, you're a business person. You just want to, no, it's not that. It's the whole picture. I see the effects of young people not being able to go to school. They can't see their friends. They can't participate in the activities that are wholesome. It has a very negative effect. And as well as the financial loss, not just of our company, but of everyone, and the emotional destroy that I'm seeing happening on people. People are losing their pride in being able to work and accomplish something and pay for something themselves. So I just wanted to call and say, I totally support you, commissioners, and I am just so proud of you that you had the courage and the strength. And boy, I tell you, it really goes hard when they say you're cowards. You are not cowards. You are courageous and you are strong. Thank you.
Thank you, Randy.
Laura LeBeau, WLBR and WQIC Radio. I would just like to ask, I was struck by what Pastor Rothacker said earlier in his comment, that churches are not under the order to, to socially distance or to stop having services under the red zone, and that they would begin their services again, I guess, at the end of the month. And I guess I would just ask Solicitor Warner, is that true? Can churches continue to hold services even though we have been under this restriction of having group meetings?
Commissioner Phillips, would you like me to respond?
I'll take a shot at it and you can fill in around it. My understanding is that they are allowed to congregate in the yellow zone up to 25 people. And as far as the social distancing, I think they still have to, they still have to follow the CDC guidelines. So if churches are contemplating opening, a lot of them are moving things around so they can have the social distancing and have all the guidelines followed, but to try to get people back into church, to get out of isolation and to give them, back into some kind of normalcy. So Dave, I don't know if there's more to it than that, but that's what I've been told by some of the pastors.
Yeah, and I haven't specifically looked at this in some time, but my understanding was that religious events were not directly prohibited under the governor's order, but yet recommended that they comply with CDC recommendations and the guidelines that are established for every county. So I believe religious services have been permitted to still occur, but with the strong recommendation from the governor's office that they not occur in the event that they would violate the gathering orders and other restrictions that are in place for the various counties.
Thank you. I wanted to also say that I, a few days ago, interviewed District Attorney Pierre Hess-Graf, and she somewhat clarified that she does not intend to criminally prosecute businesses that would reopen in defiance of the governor's color-coded system. However, if there are credible allegations or credible charges that result in a citation from state police, for example, she will prosecute that, because she is prosecuting Middle Creek Roofing Company, which is the only company in the state currently that received an actual enforcement citation from state police. She said that she is going to request that their punishment be a $25 fine, but she is nevertheless still going to prosecute. So credible, my understanding from her was that credible cases of violations will be prosecuted if under this current guidance. My other question was for Commissioner Ames, and I was just curious if Governor Wolf ever returned your call from the other day.
Thank you for asking, Laura. No, he didn't. And I thought about calling again yesterday, but I don't know what I would have to do to get his attention, because I still think that had the governor been willing to sit down with folks that he considers to be cowards and not agreeing with his edicts, that still things could be worked out. So I had hoped that would be the case, but he
Would
has
there
not
be
returned.
anything would there be anything the governor could potentially say to you that would perhaps change your point of view regarding this?
Well, interestingly enough, Laura, I actually thought about that. I thought, well, what am I going to say or what am I going to do if the governor returns my call? And I thought that what I might do is ask the governor to give me and the rest of the residents and the business owners in Lebanon County some hope. We've had a lot of talk about hope today. And I had hoped that he might be able to give me some hope and possibly some projections. I understand now there are 13 additional counties and they're all in the southwest corner of the state. And I guess Lebanon County and Lancaster County and Dauphin County were not even going to get honorable mention.
But you know what? That could change as soon as we get 14 days below 50. We could get out of this before the June 4th deadline that he said. He's willing to amend it. So if we just stick it out and get our numbers where they belong, we don't have to give this false hope to people because, again, people are questioning if this has any meat to it, this resolution, other than the county itself, the county buildings. But we cannot dictate, because there's a mandate from the state, we cannot dictate to the business what they can and cannot do.
I'm glad you clarified that, because this formula is not a CDC formula. It's a Pennsylvania formula. And the lady that called earlier, the retired nurse, said that, this goes against the CDC. No, that's not a CDC regulation. That formula is Secretary of Health and the governor in Pennsylvania. So.
Thank you.
Thank you.
Russ Diamond, yes.
Thank you so much for taking my call. Thank you, commissioners, for showing the courage to actually move forward with this resolution. I do want to clarify, the previous caller had asked about religious institutions. The governor doesn't give permission to any religious institution. Religious institutions are exempt from every activity of government, including the courts, the General Assembly, and the governor. Pennsylvania was founded upon religious freedom, and any officer of government who tries to interfere with that is violating the very precepts of our founding. But again, I want to thank you all for your courage for moving forward with this resolution. Commissioner Litz, and you talked about it a little bit in response to the last call, this 50 of 100,000 figure. First of all, I want to let you know that the governor has ignored that figure in other counties. He opened up Allegheny County, and they are not in that figure. So I wanted to ask you, Commissioner Litz, because I've asked you a similar question on your Facebook page. Can you tell me anyone, any expert, any scientist, any medical professional who is the author of the 50 out of 100,000 figure? Or can you name any expert medical professional other than Dr. Levine or the governor who has come up with any of these edicts?
Well, I pointed out at our last meeting that Dr. Fauci, who is the advisor to the president, has said that we're not in a position to open up everything at this point.
He's advising the president. I'm asking you about who's advising Dr. Levine and Governor Wolf.
So they're not allowed to take Dr. Fauci's advice?
I'm not sure they're on the phone with him. All right. Well, thank you, commissioners, for your time. I appreciate everybody else's comments, and I concur with most of the commenters so far. Have a good day, everyone.
Thanks, Russ.
Thank you.
Jim doesn't have a last name.
Hey folks, it's Jim Bernheisel here. Good morning, Commissioners. Appreciate the opportunity to address you this morning. I'm a lifelong resident of the county, and I've been in business in the county employing people for almost 40 years. And I have a few thoughts I'd like to share with you and the other people listening, and they're not in any particular order, but hopefully they'll make a little bit of sense to you. In the resolution, during the reading of the resolution, the words that were striking to me that were used were economic strain. As you'll find out, I'm in favor of this resolution, and so I'm not nitpicking it, but I would rather see the words economic devastation. Strain makes it sound like it's a little tough, like maybe you lost a little of your business, maybe not making as much money as you were, which goes to the comments by several about the greedy business people that want to be open. But I would say it's more like economic devastation. I have many friends that are losing everything. They're never going to reopen. Those jobs are lost. And, you know, Commissioner Phillips spoke to some of these things, but there are lots of studies we hear from the medical professionals and the modeling of the coronavirus, which certainly it's a serious issue, but most of the models have been dead wrong. Actually, if I was wrong that much in my business, I'd be out of business, or I'd be out of a job. And I haven't seen hardly any studies, very few, for things like the erosion of the tax base, or as Commissioner Phillips mentioned, the depression, the suicide, the domestic violence, all the ancillary problems that we know for a fact will go along with these things. And I just find it interesting that those things are rarely mentioned or undermentioned, to be sure. Secondly, I'd like to point out that I think the county needs a plan. And there's a couple of reasons for that. One is that 10 years ago, if you'd asked me, will you ever see a day where your government will forbid you from working and earning a living to feed your family and forbid you from going to church? I'd have said it'll never happen. You're crazy. You should put your tinfoil hat on. Yet, that's exactly where we are today. And I would say to you, the reason the county needs a plan is because we have little to no state plan. In fact, as reported on Penn Live on May 13th, this is a quote from Secretary Levine when questioned about moving to different zones. The answer given was this: we have not determined that type of criteria at all. In fact, we haven't really determined the criteria to go from yellow to green because, of course, it was only 5 days ago that any counties went from red to yellow. My goodness, we've been doing this for 2 months. You've been telling people they can't work, they can't earn a living, they can't go out, they can't go to church, and 2 months later, you tell me, well, we really haven't had time yet. I mean, it's just so disingenuous as to be unbelievable. I will tell you that we reduced to, as businesses, various groups begging the governor for permission to open, which I just find appalling and disgusting. From lawyers to real estate agencies to car dealers. Now myself, I'm in the motorsports industry. The motorsports group has a House bill presented right now that surely the governor will veto after it passes. But even so, what bothers me is we are all groveling at the governor's feet to go, please let me be open. And it just should bother all of us. And I will push back on it. You know, I know this resolution doesn't force any businesses to open, obviously, but also it does give businesses some cover that we have a legal, or an authoritative entity that is saying to us, hey, you have some ability to make some decisions for yourself here. Obviously, they can't directly override the governor or the state mandate, but it does help us immensely. I will push back respectfully on Commissioner Litz a little bit. When you mentioned to not rush, I would question, I've asked this of many people, how many cases are we waiting for? What is the number we're waiting for?
100,000 residents.
Excuse me?
50 positive cases in
Yeah.
100,000 residents over a 14-day period.
Perfect. But you didn't answer Mr. Diamond's direct question about where that number came from, what medical professionals recommended. But nonetheless, fair enough. But also, you did say that June 1st has been the date from the beginning, and that's just simply not accurate. We were specifically told we needed to be in lockdown till May 1st. I was at the protest on the Capitol steps when the governor made his childish, petty, vindictive extension to May 8th in response to that rally and protest. Then it was May. I promise you we'll be in some sort of lockdown by August if other counties like yourselves don't take some action. There seems to be no mention there are counties that have met the criteria, yet they haven't been allowed, and I'm using allowed in air quotes here, to open. But also you mentioned the insurance problems that might go with the county making this statement. You asked, I think, the solicitor about that, and you worried about the tax increases that might be seen from said legal problems. I would flip that around and say, what about the tax problems we're going to have from businesses not being open? There is going to be an erosion in the tax base like this country has not seen in a long, long time, probably since the Great Depression. And also, you mentioned the loss of licenses. Businesses could suffer their loss of licenses. That's absolutely true. But you know whose decision that should be? Mine, not yours. If I choose to defy the governor, many people have, out of desperation. I know people personally are saying, I might as well risk it because I'm going to lose everything anyway. What good is a license without a business, a building, or money, or employees? Finally, I would say this. I'm asking our government in general, but you commissioners, because I do think you're taking a great step here, and that's to treat us like adults. Adopt a resolution, and then get to work on drafting the go to green resolution, and then get to work on opening us up. This is nonsense. It needs to end. And I appreciate your time. I appreciate your efforts. And also I appreciate those who have a difference of opinion and the opportunity to share this. Thank you. Have a good day.
Jim.
Thank you.
Commissioner Phillips.
Yes.
Could I just to state something that Jim brought to light, and I wanted to bring out today as well, is that we're asked to have confidence in this plan of getting us to yellow. And as Jim pointed out, the Secretary of Health admitted during the press conference a few days ago that they do not yet have the criteria for businesses moving from yellow to green. Now, I find that incredible when we're asked to have confidence in this plan and abide by it, and they haven't even at this point determined what the next step might be. So that seems to be a serious problem.
Thank you. Next up.
Laura Wilder.
I think we can allow the participant to give their name.
They're on mute.
I was on mute. Excuse me. I was getting prepared. Thank you for listening to me. I have another number of things.
Laura, excuse me, would you repeat your name for us?
Laura Weidler.
Thank you.
Resident, Lebanon County. Just a few things. I think the resolution letter is great. I appreciate Dr. Hoover's comments to inclusion of the reopening plan, your ideas of using the telework, flexible hours, etc. This does pave the way for others. It is not that we lack intelligence enough to plan and execute within the guidelines ourselves as business owners, but it is important that you in the leadership position simply set the public example. So I appreciate that. When I read the resolution, to me it was clear that it was the county offices. And in the fourth paragraph, this statement is clear that limitations on businesses still exist at the civil and state levels. So a business must decide for themselves. I would say to those businesses, and would it be wise to consider a legal counsel for a signature of release? So that would give them some civil protection. In thinking of what Joellen, you had shared with the yellow phase for Plan of Pennsylvania, you wanted the details in that. as far as what the sanitizers and everything like that. I just think we need to keep the document simple as possible. I respect your attention to detail, Joellen. I am a detailed person myself, but those items are covered underneath the safety standard provided by Governor Wolf and Dr. Levin. Those were provided in detail with the state information there. And for Jim B to point out the economic strain, yes, it is more like economic devastation, as we are losing not just our businesses, but there's a risk of losing our rights. I just wanted to share with you some perspective. You know, Mrs. Pink is concerned and others concerned that this will skyrocket, the disease will skyrocket. We must be also aware of how viruses react. And we learn this in a basic biology class, that they are unstable, they do react to temperature, they do break down. We have the sunshine working in our favor. We have, as it destroys the viruses, Northwestern University spoke about people with chronic vitamin D levels and how that puts you at a susceptibility to the viral and the cytokine release, so that it does explode in the lungs. So there are things that the vitamin D synthesis naturally occurs when we are out in the sun. We do need to appreciate the change of weather that's coming. We do need to appreciate the sunshine and being able to be outdoors. We don't need to have, I am not fearful of this skyrocketing because nature is in our favor at this point in time. As we come to winter and a close, I'm concerned about people's immune systems as we are all staying within our own environments. So I think that there is a concern. If a business is opening up and there are people there not wearing masks, and I'm not comfortable with that, I would say I need to walk out of the place of business. That is how I'm going to show that business that I do not support what they do, and that's a freedom that I can have. I think we also need to be concerned, and not just with businesses, but where this is going in the states around us. In Los Angeles, excuse me, the government filled a skate park to prevent anyone from violating social distance orders. The citizens then turned it into a dirt bike track. In Elizabethtown, New Jersey, police are using drones donated by the Chinese company DJI to spy on backyards and other places patrol cars cannot reach. They look for social distancing violations personalized by $1,000 fines. It is claimed that the drones are not taking pictures or collecting the evidence. A mother was arrested and handcuffed in Idaho for allowing her children to play in a park. We also seen this on the news where a father was kicking a soccer ball with his son and handcuffed in front of his son and taken into custody. Meanwhile, we have to also look at what certain governors are doing by allowing criminals out of prison because of the COVID virus, only to repeat crimes and then get prosecuted again. We have to be careful as far as the reach and what we are allowing. We have to look at the states around us, and I'm sorry, we have to consider a slippery slope. We have to consider additional motive, and it is important to take this stand because our government, federal, state, and local, and I appreciate all of you in our local government, but we need to protect our rights. There's not another place to flee to start another country, as this country was founded upon. The source which I was just reading from was the Association of American Physicians and Surgeons, volume 76, May 2020 of this year. And this is important. This is Dr. George L. Smith III out of Covington, Georgia, had some information here. As far as numbers, when we look at the Kirkland Nursing Home in Washington State, 47 out of 125 patients died of the coronavirus. And right there, I just would like to add, when we're speaking about coronavirus, we do need to distinguish between coronavirus, which is very common with numerous strains, and COVID-19. When we're looking at statistics, we need to know that they are COVID-19 statistics. This differential is very important because the concern is about COVID-19. It is not about coronavirus. So back to the nursing home commentations. So the question was raised, why? And how do we prevent such an occurrence locally? Dr. Smith learned that a physician in Texas was treating patients in a nursing home there with hydrochloroquine. Of 135 patients in that facility, only 1 died of COVID-19. A French study as well, as reports from India, had supported the benefits of using hydrochloroquine in patients with a coronavirus infection. When I say hydrochloroquine, it can just allude to a political position, but that's not what this is about. It is beyond anecdotal, and it's been observed and effective when properly prescribed. And by that I mean weight-based prescription. We have tools we have more knowledge than we had when we first learned about this virus. We have more tools. We do not need to be afraid. We need to trust the medical community. We need to trust in ourselves. And we need to appreciate nature as it is.
Thank you.
I would also like to add that as a mother, it is very, and looking at what is to come, I am very concerned about mass vaccination. And there's a lot of money being put to the research of mass vaccinations. I am concerned that the fear that has come out of all of this has been brought about by closing down the school system. Every mother is emotional right now as we're trying to maintain everything that our lives demand of us while taking and educating our own children. We are thankful for what the school is doing, but we are here with our children. People are emotional because the businesses are struggling, and they have a right to be. Churches, which help build our faith in communicating and assembly together, strengthen us in our faith. Iron sharpens iron, yet we are not assembling. And just like the businesses, the churches should have the right to assemble. If they can assemble within a group of 25 people and remain 6 feet apart, so be it. But we shouldn't be looking out to police or critique that.
Laura, excuse me, Bob Phillips here. Would you mind if you could wrap it up? We're on a time frame of trying to get everyone in. And
I apologize.
Yeah, that's okay. Are you soon near a conclusion?
I think that's just fine. Thank you very much.
Okay, thank you.
Thank you.
If it please the board, I'd like maybe to consider asking people, I don't know how far we go with the enforcement, but maybe a 2-minute, address to us, if that would be appropriate. I don't know, Bob, how many do you have in the queue?
Right now, there's 12 raised hands.
Wow. Yeah. 2 minutes sounds logical for that many.
Yeah, I think 2 minutes is reasonable. Hopefully they can, you know, make them.
Recorder of deeds. I was not able to attend Wednesday's meeting, so I just wanted to quickly go over that my office will be operating by appointment only. I will have sections divided up for searchers. Please contact me to set up an appointment time. I have different schedules laid out to do that. We'll take document drops by appointment only. Give me a call. Notary commissions would be the same. Give me a call, please. And you need to also correspond with the prothonotary, so an email might be better with all three of us so we can correspond at correct time that fits us all. And we will also be doing appointment only with the Veterans Affairs to do the veteran IDs. So I wanted to just quickly run that down. I wanted to thank all the row officers for helping to work together to keep things going here in my office. And I wanted to thank the commissioners for taking the lead. You know, compared to the other counties, you guys were way out in front of this, I believe. You closed down a little earlier than the majority of the other counties. And at the time, I was a little confused about that. But I know you've been all watching this very closely. I have faith in your leadership with this. And I just want to say thank you for the resolution. I believe you are doing the right thing. When I read the resolution, the only directives I see pertain to county government, county property, the county buildings. The statement in the resolution basically is saying, since we all took an oath to uphold the Constitution, we are standing up for the rights of the people. It's the individual rights of the people. They have, under the state constitution, again, Article 1, Section 1 of the state constitution, they have the right to acquire, possess, and protect property, life, and the pursuit of happiness. It is their responsibility to be responsible if they do decide to reopen. You're asking them to please follow the yellow phase. It's their responsibility to do this safely. And I have every confidence in Lebanon County residents that we are able to accomplish that. I also wanted to quickly, want to mention House Bill 2412. I'd like to ask for people to please contact the governor to ask him to please sign this bill. It was just passed yesterday. It has to do with real estate. We're the only state that completely closed down real estate. Our office last year sent the state $6.5 million. We raise millions, we bring in taxes to
Excuse
the
me,
county.
Don, we're going to be asking people to.
Yes, I know. Thank you. I wanted to bring that up, but I just want to thank you for your leadership on this.
Thank you.
My name is Robin Conwell. I'm a Lebanon County resident, and I think it's misleading, the terminology used in the proposal that we are moving Lebanon County to the yellow zone, when in fact, and as evidenced by all the comments, it gives the impression that we are saying it's okay for businesses to open, which in the further in the document, and then it will mention that it doesn't apply to businesses which are still in the red zone by the state. So I would consider like changing that terminology and make it crystal clear that this is only a Lebanon County office change, because I think it's not widely understood why we need to limit interactions in the public, because the virus doesn't have legs. For every point of contact is a potential cause of spread. So, and obviously our numbers haven't gone down fast enough to get us legitimately into the red zone. by doing this and giving people the false idea that it's okay to go out and start relaxing their care in their interactions, we're going to slow down the progress we've made, and the proposal will have the opposite effect of what it's intended. So it'll take us longer to get down into that lower level of transmission, and businesses will have to stay closed longer. So I would definitely consider making it absolutely crystal clear that this does not apply to everyday businesses.
Thank you.
And also there's been a lot of discussion about the personal rights, and it's your right to stay home if you're not comfortable. However, there are certain life-sustaining activities that need to be done. And if the level of infection in the general community is higher because some people choose not to follow the guidelines, then it makes it a higher risk for those people who understand the risks and would choose to stay home. However, we still need to go get our groceries. People in frontline positions still need to go to work, and it puts them at risk. So it is not just a personal rights issue.
Thank you. Next.
And I am a salon owner in Lebanon County. And I just want to thank all of you for providing us some well-deserved hope. With all due respect, Commissioner Litz, we are no longer willing to stick it out because we have been sticking it out. And if we go to June 4th, we're looking at a whole first quarter that our business cannot be open. I understand our risks are higher because we cannot accommodate that 6-foot distancing, of course. But we have everything in place and ready to go to, with guards set up and wearing masks and taking temperatures, keeping our census down. We can operate with 10 people in the building at one time and maintain a 6-foot distance, other than the closeness that we have to have with our stylist. That's one person with a mask. So and we still have a decision, even with the courage that you guys are taking to push forward and bring back the rights that we deserve. As a state license holder, we still have to make that decision. And right now the decision is, do we open and risk losing the business through having our licenses revoked, or do we stay closed and risk losing our business? It's not a good choice. And we just need direction, and we're thankful for the hope that you've given us and the courage you've taken. Thank you very much.
Thank you, Suzanne.
Got my timer set here. Thank you folks for taking my comments. My name is Dr. Adam Malbert. I'm a hospitalist by training. I'm board certified by the American Board of Internal Medicine. I'm currently pursuing degrees in health analytics through Northwestern University, as well as health systems engineering through Johns Hopkins. First of all, I would not want to be in any of your positions having to make the decisions that we face now. That being said, I hope both sides of the aisles are being consulted when it comes to medical expertise here. I've heard various commenters comment on UPMC experts. I've heard people refer to Dr. Fauci. Clearly, the medical community is who needs to be referred to when we're making public health decisions here. However, one thing, this virus does not have political boundaries. I've seen it face to face, and it is very deadly. There's even new evidence now coming out of New York City this week, published in medical literature, that children are being affected by it as well, with Kawasaki-like diseases causing multiple organ failure. I'm not here to debate, and I'm not a public health expert or an epidemiologist, so I'm not here to debate the numbers with respect to the 50 per 100,000. I don't know the answer to that. What I would say is I hope that the commissioners here, I do think Commissioner Litz spoke very well with respect to need to be cautious. I do think businesses need to open up at some point. I don't know when that is. I will say this though, to the folks who have all sorts of businesses, that there will be essential employees that will be affected when we reopen. It may not be in the next couple of weeks or the next month, but if and probably when this resurges, there needs to be a task force in this county to be able to plan accordingly so that this is not just simply a political decision, which in my opinion, this is somewhat politically motivated, specifically when Dave Arnold and folks addressed the governor in a letter earlier this week. So that's all I have to say. Again, I do think you're all doing great work, but I do think a better plan needs to be placed with respect to the medical aspects of this, especially given the fact that one infection can infect, we don't even know the R value on this. One person who gets infected can infect many others. So it's not as simple as you can choose to stay home. That's true, but the one person who doesn't choose to stay home can infect an essential worker elsewise. Thank you.
Thank you, Doctor.
Commissioner Phillips.
Yes, Bill, go ahead.
The mention of a task force was made, and it might be appropriate to indicate that Susan with the Lebanon Valley Economic Development Corp has organized a task force, and they have been meeting, and they have various areas of expertise that they're dealing with, numbers and statistics and working with the business community and the health community and so on. So those efforts are being made.
This is District Attorney Pierre Hess-Graf.
Good morning. Your 2
Last
minutes has started.
Last Friday, our state and local elected officials joined together in an effort to return the individual's right of choice back to each citizen of Lebanon County. We signed a letter which stated our intention to move Lebanon County, all of Lebanon County, both public and private, to the yellow phase. Our founding fathers created this country in the pursuit of both liberty and personal freedom. Our country exists based on the American dream of perseverance, hard work, and ultimate prosperity. We cannot have this American dream, one of a better life for ourselves and for our families, without a thriving economy and healthy citizens. The decision of whether to open a business, whether to patronize a business, whether one feels safely enough to go into the community, belong to each resident alone. With responsible choices and conduct, our citizens do not need to choose between physical well-being and the dignity of work. As law enforcement, we exist to uphold the law and complete our duties. Recently, I had a conversation with someone I respect very much, Sheriff Bruce Klingler. He discussed duty as it related to our refusal of criminal consequences for all businesses and employees. The sheriff and I shared stories of the people who phoned our offices every day. They cry of financial fears, of their inability to simply earn a day's wage and pay their bills. Our citizens are out of options, out of money, and desperate to provide for their families. Sheriff Klingler poignantly stated at times we must do our duty and stand up to the giant. The giant appeared on Monday at 11:30 a.m. on a nationwide press conference. He stomped his feet, he called us childish names, he dug his heels in, and he hurled threats. I am proud of the unified position of our elected officials, of our collective refusal to both cower or cave. My office will not criminalize a hardworking citizen's right or desire to work. As long as compliance with the administration's April 15th order is met, you may open and work if you choose. My office is tough on crime. We are not tough on people simply trying to provide for their families. In the past week, I received daily responses from local citizens. They included members of our local medical community and profession. These people were proud of our actions. They remain grateful for the efforts we took on their behalf, and for the first time in quite a while, our community showed hope. Moral backbone and the ability to stand behind our positions are signs of both leadership and honor. We stated our intention to return the individual right of choice to our community. The community cried out in response and begged us to stay the course, the total course. Now comes the time to take necessary action. Today, I ask the commissioners collectively to vote yes on their resolution and move our entire county forward into yellow. Thank you.
Thank you.
Nathan Lund. I've been running a petition drive that's under the header of Keep PA Safe, and I posted it in the chat, but I also just wanted to say here that I've received responses from over 120 people that will be forwarded along to legislators, and then just around 20 that are specific to the commissioners, and those will all be sent to you. And those are in opposition to this resolution. I also just wanted to clarify, because there hasn't been much talk of the employees who work at businesses who decide to transition ahead of the governor's order. So employees will not be required to return to work if their business doesn't have a waiver or they don't fall under the yellow phase. And I just think it's important for people to know that they have that option to stay home, because you know, it's important for public health. And I just thought that that was an important matter to speak to. I'm not going to take up any more time except to just ask why was the decision made to go to yellow phase instead of green if there isn't really a risk associated with this? Thank you for your time.
Well, my answer would be I'd certainly prefer to be going to green today, but I felt that this was a good first step in getting us to this point. I think is where we should be today. But you know, as more information comes available, we may revisit and move to that issue as well.
Commissioner Phillips?
Yes.
How could we transition to the color green when we don't know how it's defined?
That's a good point.
Yeah.
Okay. Nathan, thank you.
Hey all, this is Davis Shaver from Lebtown. Thanks for being so generous with your time. Commissioner Phillips, I had a couple questions for you, and I'll ask them both at once and take my response off the air. So previously on the call, you had mentioned hotspot detection. My assumption is that Emergency Services Director Bob Dowd, who's running this call, would be the key person at the county level for this concern. In a Daily News article yesterday, Mr. Dowd was quoted as saying that he did not have the ability to identify a trend of a problem area. Understanding that this may be largely in part due to the quantity and quality of data released by the state, are you aware of an alternative manner to identify hotspots? And I'll ask the second question so you can answer them both at once. I wanted to follow up on the reference to seeking medical input. We have not been able to confirm whether the doctor you mentioned earlier was speaking in any official capacity for the VA or Penn State Hershey. My question is whether, through your capacity as a commissioner or as a member of the WellSpan Good Sam Hospital Board, have you had a conversation with a physician in a leadership position at either of those healthcare providers about moving to yellow? And do you have a sense of why they would not have come out publicly with a position on this proposal? Thank you.
Well, as far as the hotspot detection, my assumption, and if you, Bob Dowd is actually not where I was looking at the data. I was getting that from the governor's office on new cases every day and seeing that 17042 and 046 were the biggest number of new cases, and that I felt that that was a good place to start, and also some businesses. So no, I hadn't, I don't think it's a conflict in what maybe Bob Dowd is putting together, but I was getting that through data, excuse me. From the,
Time to wake up.
Sounds like a cowbell.
I had Davis on 2 minutes and he beat the clock. As far as the talking to anybody from the, I did get a statement from WellSpan. The only physician locally that I have spoken to is Dr. Yoakum, and the other letter that we got from that was read this morning came,
Dr. McCulley.
Yeah, came to me. I don't know the gentleman, but came to me through a third party. So that's why I don't have much information on him. But I did get a text while we're here that he is willing to speak with Chris, so that you'll be able to get some more information from him.
That's great. And just to follow up, is it a difference in definition of what hotspot detection entails? Because I felt that Mr. Dowd's quote was unambiguous in stating that he did not have that ability at present.
I'm sorry, maybe I'm using the wrong term. I'm just going by the case counts.
Thank you.
Commissioner Phillips.
Yes, Commissioner.
When they address the statistics and talk about hotspots, you need to be aware, and I'm sure if anyone in Lebanon County thinks about this, we see the number of cases by zip code. Campbelltown has, I don't know, probably 100 at the very most in their zip code, and 17042 and 17046 are the largest zip codes. So part of the statistics are skewed by the fact that there are just more people there. And the other thing that's important to remember with Lebanon County is we have tested the highest number in relationship to population than any of the other counties around us. So I think it's commonly known that the more you test, the more cases you're going to find.
I think we've only tested about 19% of the people, though. I saw some statistics last night.
I think
if I may, I believe that Commissioner Ames is accurate about Lebanon being the highest tested as a percentage of overall population.
Thank you.
This is a figure that we track on Lebtown. I think that the Campbelltown, maybe it's Myerstown that you're thinking of, because Myerstown or Campbelltown doesn't have any confirmed positive cases.
No, they have no. That's right. But I'm just saying that the number of people in a zip code affects how many cases you're going to have. The more people, the more cases you'll have. Yeah.
Absolutely. Thanks again. I'll mute myself and appreciate your time.
Thank you, Davis.
Joellen, just as you said 19% tested?
Yeah, it seemed like 19 to 13% was the different amounts that I remember seeing.
I think Lebanon County is the, as Bill mentioned, but we're only at 3.03%.
Mm-hmm.
We're the most tested by population of any around us. The 20% you're talking about are positives from the testing.
That's what it was. Okay, thank you. I remembered seeing some numbers and I was thinking, you're right. Yeah.
Thank you. Next.
Michael Ludwig.
Can you guys hear me?
Yes, Michael.
I just want to thank Commissioner Phillips and Commissioner Ames for looking out for the small business owners and their families, and looking out for all the citizens of the county, really, for that matter. I'll be honest, you both make me proud, really, to be a Lebanon County resident, and I'll keep it short. I also want to thank our district attorney, who's done a great job, our sheriff, everyone really who signed the letter. I really think you guys are doing a great job really representing the citizens. Over here in Palmyra, we're very grateful. Again, thank you, and I do want to just say stay safe to everyone. Thank you.
Thank you.
Had you seen that Faith Bucks at South Lebanon withdrew her support from the letter they had previously sent? She didn't realize that it was just for the county buildings opening up.
Sean, are you there?
I'm here. Can you hear me?
Yes, sir. Go ahead.
All right. Sean McCarrick, citizen resident of Cornwall Borough. I want to thank Representative Diamond, Senator Arnold, all three of your commissioners, Bob Dowd, District Attorney Hess, for their time and effort into this situation. I have a few concerns, and then it comes down to people's rights. And I really hope that you stand the course that you've shown on your vote since last Friday. People obviously are being deprived of due process in regards to the quarantine and isolation. In history, there is case for pandemics and the situation in which if this situation arises, there's still a responsibility to the citizens to uphold the rights and the due process that goes along with it. You cannot be quarantined or isolated for a medical issue without medical testing. I was denied testing early on in this, because I had no signs or symptoms, but had been in contact with a person that was a confirmed case. I'm one of these people that believe I was ill with it back in late November, early December, sickest I've ever been in my life. There has been no testing for antibodies to see, and the testing that's going on now, and you guys may correct me if I'm wrong, those people that test positive for antibodies are going to the positive statistics. Am I correct?
I'm not sure the answer to that. I would assume, but I really don't know.
Well, the information that was sent by one of the senators the other day in a memo is that is the case in Pennsylvania, is those that are testing positive and have antibodies but are not ill, those numbers are being shown as a positive result.
Yeah.
And that's not the case, because you have 14 to 21 days total that, so we're not getting recovered data and we're getting bad results listed in with, in other words, what I'm saying is it's going to skew our totals in the county for people that are not truly positive and infected. I'm asking for clarification on the mask order. My understanding is that has been backed off and not mandatory. It's now recommended again, but yet we're seeing nothing on that being put out publicly. Am I correct that it's a recommendation again?
I would just say at any given time during this whole thing, you just have to stay tuned to the current CDC guidelines.
Well,
but I think you're right. The state, the Secretary of Health has said now that it's strongly recommended, not required.
Correct. And law enforcement's being called because people are refusing to wear masks as they enter into establishments on a recommendation versus a mandate. I would hope that you, and I'm going to end it because of the 2 minutes, and I'm sure I've gone over. I had a lot of questions, but I don't want to dwell on it. I would hope that you stay the course to vote to move us into the yellow. I am one person that eventually will be looking into legal ramifications of being denied my pursuit of use of personal property outside of Lebanon County, being quarantined to my local area, and the non-essential travel and trying to follow the guidelines and requests. I am being deprived of use of personal property, and people have to keep that in mind, that we do have rights as a citizen to move about, and I have a right, if I'm not sick, to move about. And it's become very frustrating. We have to build an immunity to this, and being quarantined in our house is not going to help us build an immunity to it.
Thank you. And Sean, if you have additional questions, if you want to reach out by email, I'd be happy to try to bird dog those for you. It's rphillips at lebcnty.org.
Appreciate you letting me jump back in here again, and I promise I'll keep it brief. But it seems to me that there's been a fair amount of confusion among the callers about what this resolution actually means. I'd like to kind of reference back to what I believe all the other elected officials believed was going to be the resolution, and that was that it was going to apply countywide to the public offices, but as well to private businesses. And I think the resolution needs to be amended to make that clear to both the citizens and to anybody who may choose to challenge the resolution, that is absolutely the intent. All right, the county is doing what's best for its citizens, and I think it needs to be clear that that's what the intention is. That this is designed to apply to private businesses in addition to the public agencies. Look, we need to make sure that everybody knows that the county is supporting them, and that we are not going to back down from what I would claim would would consider to be tyranny from one man who's trying to tell us how to live our lives. We cannot be afraid of a fight. No one looks forward to the fight, but we can't back down from a fight when it's the right thing to do. And right now, the governor has given us no choice but to fight for our rights and our freedoms. So we need to do that, all right, because he's trying to dictate our lives. He's trying to dictate our futures. And worst of all, in my mind, what he's trying to do is dictate the futures of our children and how he's going to negatively impact all their lives before they even get a chance to stand up for themselves, to fight for themselves. So, you know, I would ask you to amend the resolution to make it crystal clear that this is designed to apply to the public offices and the private businesses, and that you know, if we wind up having to fight this as a county against Governor Wolf or whoever may choose to challenge it, that they all know we're ready to take on that fight if it's necessary. Thank you for allowing me to speak again.
Mr. Chairman, before the senator goes, could I just make a clarification on the resolution?
Yes.
Maybe help some of the folks who are chatting and listening. If you look at the resolution, the preamble paragraph states that Lebanon County will operate under the yellow phase. Further down, it talks about, in the next two paragraphs, it talks about municipal buildings and satellite offices and refers to that as Lebanon County government. So there's a distinction in the resolution between Lebanon County and Lebanon County government. As it goes on, the 4 points that will be observed by Lebanon County government are then listed. And again, it refers in the next few paragraphs to Lebanon County. So there, you know, while it goes back and forth in the resolution, it does distinguish between Lebanon County government and Lebanon County as a whole. Just thought that might help a little clarification.
Jamie, I was just thinking, in the preamble, could we clarify more or amplify to include Lebanon County and private businesses, or, you know, county business and private business?
It's your resolution. You may adopt it.
I'm just asking.
Sure.
Senator Arnold, is that where you were going with that?
It is. I just wanted to be clear because I've heard some people that have called in who seem to be unclear. And if there's some that are unclear, there might be more that are unclear, again, including the governor and whoever else may not agree with the resolution. So I think it just needs to be crystal clear that this is designed to apply to everybody within the county, and that includes obviously the private industries, the private citizens, and that it allows them to move in, or it permits them to moves them into the yellow phase, and permits them to operate their businesses within the boundaries of the yellow phase, rather than continuing to be in the red phase.
Okay. Commissioners, any further amplification or clarification on that issue?
Well, as our administrator said, I think it's clear, but if you need to amplify it in the preamble, that's probably the place to do it.
Good with that.
And what type of wording are you proposing or looking for to do that?
Something that clarifies that we're not just speaking of, when we say Lebanon County, which includes county government and private business.
The private sector, yeah.
Private sector. Dr. Hoover, who had talked about maybe having a line in there about what the county's doing to give people an example of what people are doing to accommodate childcare in the absence of the childcare businesses being open. I don't know if that's redundant or gets too granular, but I just thought that was a good observation. And the only other where we say economic strain, I don't mind the word of economic devastation, which would give a more probably a clearer tone to it. Bob, how are we doing on the Faith Bucks? Sorry.
Oh, that's okay. I just wanted to wait for my opportunity here.
Yes,
Faith Bucks, South Londonderry Township. I'm one of the supervisors. We are one of the townships that did pass a resolution this past Tuesday in support of your May 8th letter. I just wanted to be clear because I did private message you that I was upset pertaining to this resolution because it doesn't seem clear as to whether or not it is for the whole county or just for the county buildings. It seems to me that Commissioner Litz, that you are under the impression that it's just for the county buildings. There's been back and forth, and I appreciate Senator Arnold asking for that clarification to be greater. And I also appreciate District Attorney Pierre Hess-Graf to also clarify her stance. We, as South Londonderry, passed this resolution. I just didn't want to be misrepresented. I do support your May 8th letter that pertains to the whole county. So I just wanted to make that clear. If that is what you're doing, you have my full support. I can't speak for the other supervisors now, but per our resolution, that's what we were supporting, the whole county going to yellow. That's it. Thank you.
Thank you, Dr. Brooks. Andy, you're up.
All right, thanks, guys. Sorry, I know this meeting has gone super long and everybody wants to get off the phone, I'm sure, but real quick, I've reached out to the governor's office several times to only hear nothing back. So I feel like the county, this is our one chance to kind of get our message out there and have a little control over the situation. So while we don't have control over the virus, we do have control over the situations that have led to where we stand today as a county, as a state, and as a country. My wife and I are both 41 years old. We have 3 young boys. My parents are in their 70s. My wife's parents are in their 60s, one of whom you've heard from today. We work with employees, customers, suppliers, and vendors of all ages. We have a lot to be concerned about. I'll share my parents' view on what's happening right now. They've lived a good life. They're mostly healthy, and my father still chooses to go to work every day, even during COVID-19. He was a second-generation Lebanon County business owner, and he's in the group that is most at risk, according to the research. His view is that he is not going to let the virus control his life. They do not want to live in fear and have someone tell them what they can and cannot do. Their faith helps them with this decision. They are, however, concerned about their nest egg that they have worked their entire life to build up. This is in jeopardy if we don't start making changes right now. I've spent countless hours researching and debating different arguments of COVID-19. It all leads back to the same argument. There is no reason to be shutting our state down, much less Lebanon County. It was stated early on, the cure cannot be worse than the problem itself, and that's exactly what is happening. If I had more time, I'd love to dive into that subject, but I'll save all of you the trouble. The numbers are showing the virus is not as deadly as once thought to be, even though the skewed data is showing otherwise. My opinion is that we need to isolate certain at-risk groups and protect the people in nursing homes. This is where a majority of the deaths are occurring. We should not be destroying the lives and livelihood of everyone else for a very, very small percentage of the population. We as Americans make choices every day that could ultimately result in the loss of our life, but we don't stop doing that. The country was founded upon freedom, and we should have the right to choose. If Lebanon County opens before you think it should, you can stay home while others go out and live their life. I'm in favor of moving from red to yellow. Thank you guys for all your work.
Thank you, Andy.
Thank you.
Thank you, Andy.
Hello.
Hello.
Hi, this is Peggy Heisler, a resident of Lebanon County. I'm agreeing with the majority of the people who are calling in, and I completely support passing this resolution. I also have heard that the state police are going to be targeting Lebanon County residents and businesses, and I wanted to know your thoughts on that, and also that the State Department of Ag is also going to be targeting restaurants who allow dine-in services, and I wanted to know if there's any of your thoughts on that also, and if there's going to be any kind of retribution that the patrons will have to suffer if we go there, and also the business owners. It just seems very unfair, and I hope someone is going to be able to back up the business owners that choose to open. Thank you.
Well, my only comment to that would be forewarned is forearmed, but that seems to be some of what is circulating out there. And again, it goes back to personal decisions and choices, and the repercussions are at this point unknown.
Okay.
Oh, go ahead.
Chris Coyle is back.
Hi, Chris Coyle at lebtown.com. Just following up on just on what Senator Arnold said. Senator Arnold, as I heard it, and this is almost a quote, urged you guys to amend the resolution to say that it, quote, permits them, meaning business owners, to operate their businesses within the boundaries of the yellow phase, unquote. And that's probably not verbatim, but close to what the senator said. If the commissioners would amend the resolution to include language like that, and if any business who relies on that language gets cited or prosecuted because the governor says they're still red, does that mean that the county then, at its time and expense, would defend those businesses under the language that Senator Arnold proposes?
That's not my understanding. I think we made it clear that if you choose to operate under the guidance of this resolution, it is on the responsibility of the owner, the business operator.
Okay, and perhaps Senator Arnold will buzz back in and see if he agrees with your statement, Mr. Ames. That's all I wanted to know. Thank you.
Nora Shelley.
Go ahead, Nora.
Yeah, Nora Shelley, Lebanon Daily News. Just one thing, if you are going to be amending the resolution, will you be providing a copy of the updated updated version of it?
Yes.
Okay, thank you. That's it.
Bob, where are we?
Got two more.
More. Laura.
Well, I guess this is like Reporter's Row here. So let me ask the question, because I think, and I appreciate Senator Arnold clarifying his thoughts and his position. And I'm just curious to know, was that always your stance that this resolution was to cover businesses as well as the county government offices and the courthouse? Because I was under the impression, I think I came in thinking it was that way and then got swayed into believing that you were really only referencing the government entities. And then after Senator Arnold came back in, now I'm back to, we're covering everybody under this resolution. Is that correct?
For me, it's covering everybody with the local district attorney's guidance that they will not be prosecuting businesses that do it. But beyond that, we can't speak. We can only speak for our local government's expansion of going into yellow, and the issue of being prosecuted is that's in the area of the district attorney, and she has said that they will not be prosecuting. They will be educating if people violate by having more people at a meeting than they should and things like that, or at a restaurant if they choose to open. But that they will not be, the burden of fines and so on will not be added to their already tough situations. So they're not, it's not a guarantee that they'll not face issues above Lebanon County, but this is meant for us to give our courthouse to be open and an example, and also to include all businesses in this that will not be prosecuted on the county level.
And for clarification, Commissioner, the county will accept no responsibility for the defense of their licenses and things like that, because obviously that would be opening a can of worms. So we can't be responsible for that. And I think that the resolution states that clearly.
Well, and I don't mean to be, I'm sorry, but I'm not trying to be too literal, but why even bring in this this reference to privately owned businesses if really at the end of the day you're saying it's on them anyway, whether they choose to open or not? The liability will be theirs if they do choose to open. Why even reference them in the first place? Why not confine this resolution to those areas for which you do have the direct control?
Well, we have control at the local level for the prosecution. We just can't go beyond that, and that's what this is meant to indicate.
Okay, thank you.
If I may interject, commissioners, you can't stop a lawsuit by what you just proposed. People can sue you, and if the insurance doesn't cover it, we're going to have to take that out of the general fund. And if it becomes extensive, it could result in a tax increase. Don't mislead the public, please, into thinking that we can't be sued. We can.
I wouldn't want to let the residents think that we can't be sued. And as I indicated earlier, that didn't seem to be a problem to you when you were attacking the owner of Cedar Haven, because we were in fact informed that he was considering a lawsuit. And you were checking to see if the county's insurance was going to cover you. People need to know the whole truth.
Okay, well, let's back to Laura. Do you have anything else?
No, that was all I had. Thank you very much.
Thank you. Yes, Andrew Miller.
Yes, Andrew Miller, lifelong Lebanon County resident, owner of a business that was considered life essential from day one of this COVID-19 outbreak. When Wolf made his announcement to shut down businesses on Thursday night, by Sunday, I had already been contacted by the U.S. government. We make a lot of military parts. We make parts for pharmaceutical plants. We make parts for food manufacturing. We never got an exemption because we are actually life-sustaining. And my first reaction was, oh crap, how am I going to keep 135 people safe? Well, my staff and I worked tirelessly. We shut the plant down essentially for the first week so that we could plan, that we could move equipment, that we could do things to try and make people safe, that we could educate our employees. I brought in a medical expert who trained my staff, and I individually brought employees back in groups of 6 or 7 at a time to explain to them the science behind COVID and how to protect themselves. And while I can't make you do anything outside of work, I need you to understand this is serious and you need to distance outside of work, as well as the expectation that you will distance at my business. We've had 7 or 8 employees tested. I did have 1 employee test positive about 4 weeks ago. That gentleman will be returning to work Monday. We distanced people in a way that he was in only around 1 other employee, and they were 10 feet apart at best, at the closest. They both wore masks. Nobody else became infected. I understand that this could change in a heartbeat, and I've explained to my staff and my employees, even though we're essential, if I would have a major outbreak within our walls, I will shut down the plant. But to date, we've had really good success. For 8+ weeks, 130 people have been working in our facility, and we've not had the major types of outbreaks that you've seen in meat processing plants, because we took it serious. We follow the rules. I want to see other businesses get the same opportunity to prove that can be done safely, smartly, and intelligently. I thank you for what you guys are doing. It's much appreciated. I still love this country, and I love seeing the political process take shape and do what it's doing. Even when I feel personally some of the rights are being violated, we're still the greatest country on earth. And Lebanon County, you should be proud of yourselves for what we're doing to at least facilitate and have these discussions democratically. Thank you.
Thank you,
Thank you, Andy.
Okay. Do we want to then go to the discussion on the wording?
I apologize. There's still more raised hands. I just brought the next one in.
Angela?
Hi, I'm Angela Marr, and I am a resident of North Cornwall Township. And I do appreciate you all having the meeting live so we can participate. My feelings are, I consider Lebanon County still in red, according to the governor. I understand the need for businesses to, want to reopen and get their income stream going and people to be able to go out into the community. And I respect that. I myself am immunocompromised, so I, am careful. I will continue to be careful to wear my mask and do those things that I need to do. My concern is, first of all, the way some of this resolution was brought about, the letter that not everyone was asked to participate in. I'm very dismayed at that. I am glad you are all here now talking about it. And I do think we need to keep our focus on Lebanon County and what's going on, not outing other people on what may have happened 2 or 3 years ago with Cedar Haven. And let's not make it personal. But I am concerned about the language of the resolution. I do think if you want to open the Lebanon County Courthouse and the Lebanon County offices, by all means do so. I think that's a good idea with, of course, the precautions. And I think really the resolution should stick to that, because if people are very confused, the people I'm talking to are very confused. They already think the county's in yellow, which really isn't the case. They think that this is a free-for-all, which really isn't the case. And I don't want to see that turn into something that we all don't really want to see. I think the county needs to be very careful in their language. The resolution probably should stick to the county buildings and not individual businesses. I think individual businesses know now if they do open, they put themselves at risk with insurance, with their licenses, and the county isn't going to bail them out on that, which I don't expect the county to do that. But I think including businesses in this resolution is going to give them a false sense of hope and security, which really isn't fair. And that's my comment. I think we're doing an okay job so far, and we should continue to do that. But let's make the language very, very clear and not, give some business.
Let's go back to the preamble.
Okay, there's some things I'm clear on as I follow along here on how you want to change the wording. Other things I think I still need a little bit more clarification. Currently I have that the preamble, the desire is to specify that further beyond just the words Lebanon County. I have that in the 4 items that are specified that county government will follow, adding in common areas in county directed facilities such as break rooms and assembly rooms will be adequately furnished with sanitizing supplies, if that suffices. I have changing economic strain to economic devastation in the second last paragraph. And I'm still unclear on the reference to child care services and how you want to specify the preamble, I guess. If I need a little help on that one.
Okay. I don't think I need to insert the child care thing reference in there. That's going to be a lot of parents are going to have to deal with whatever, back to work and so on, just as they would once school is over and the child, so I think we have just the preamble to deal with is to get clarity.
Okay.
Bill, do you have any particular wording to make? Just, you know, in other words, I don't want to be going this far and then have it vague. You know, that's my goal to come out of this, is that if I wanted people to be clear on what I'm voting for and what my intent is, and I think that adding the reference to businesses is good, and I want to make sure that we have that it's not just county government. I don't know how best to express that, but I also want somehow to be clear that it is on their risk to participate in yellow.
That's exactly where I am. I guess I want to be able to encourage folks to act according to the rights that they have. But on the other hand, I don't want them to be lulled into a sense of security that the county is saying that we're going to support them legally in battles for their licenses. I don't know how we can do that. I'm not sure.
Well, as I said before, the differentiation that currently exists in the resolution is Lebanon County and Lebanon County government. But it sounds like you, in the preamble there, you want to add something to Lebanon County to further specify that it includes businesses. Is that what I'm hearing?
Yeah, I think that has to be part of it, but with the addendum or some, well, go ahead, Jamie.
May I suggest Lebanon County public and private sector?
Yeah, anything to get clarity. Yeah. You know, there's a lot of and I think this is going to boil down to the business. They're going to have to proceed as they go from one color to another. They're going to have to decide, what are the repercussions of this move? So for people to call in and say, well, people are confused, they got to get clarity before they make the next move. And so we don't want to be vague in preamble of this thing. So I think whatever you can do, Jamie, to get that. And I think private and public sector or public and private sector is a good way to do it. And then that would help a lot. Is that do enough?
Yes.
Is that?
Yeah, I'm okay with that.
When appropriate, before we vote, I'd like to summarize my thoughts.
So those would be then the changes that would be incorporated if you adopt this. So I'll just, you know, I've on the fly right here, making those changes and pushing them back out is a little bit of a challenge, but just understood that I can recap those if you'd like. The preamble would be amended to say Lebanon County public and private sector will operate under the yellow phase of the plan for Pennsylvania. The itemized requirements under county government operating would then include common areas in county directed facilities such as break rooms and assembly rooms will be adequately furnished with sanitizing supplies. And in the second to last paragraph, it would state that the undersigned county commissioners empathize with the residents and business owners who wish to return to work so that they can provide for their families and to minimize the economic devastation on their finances, etc. Those are the changes I have.
Robin Conwell suggested that it should also state that this is not a binding resolution on businesses, to be perfectly clear.
There is a mention of that, if I could say, the third paragraph. Whereas, while Lebanon County government services are being expanded, this resolution is not a binding or directive on any private sector enterprise that operates within Lebanon County.
That's clear.
Commissioner Phillips, if I may, if one of the commissioners would like to make a motion, I would suggest the appropriate motion would be a motion to amend the existing motion on the table to adopt the resolution, incorporating the amendments that Jamie just read.
I'll make that, I'll move to do that.
So we're amending the motion that's already on the floor.
Yes.
Which would make the amendments to the adoption of the resolution, correct?
Gotcha. Yep. Is there a second? I'll second the motion. Any further discussion? Joellen, did you want to give your summary? Or your...
Surely. Again, I think that public health and safety of our citizens is the goal here. And we are in a pandemic with a red order on us by the state that has been upheld by the Supreme Court. And we can't change that. We don't have that authority. So that puts the county in a liable situation, and we may experience lawsuits, like it or not, because local businesses may also lose their licenses, and we have no formal plan. We don't have enough PPE for all of the hospitals, much less rest of the businesses. There's just not enough around for them to comply with the resolution being proposed. We don't have adequate contact tracing, and we need more general testing for COVID-19. And of course, the other issue that was brought up is childcare is a big issue. The children will be more at risk if they're placed into childcare, and those childcare centers could be at risk of losing their licenses. They are state licensed. So I just wanted to summarize the possibility of the challenges that are out there, because it's so important that people not have false hope. I want people to have hope, but not false hope. Thank you for listening.
Thank you.
Thank you, Commissioner.
Anything else, Bill? Any other comments before we vote?
Just very briefly, I just wanted to recount something to those folks that are listening as an example of why I support this. In the John Wright restaurant in Wrightsville, Pennsylvania, which sits on a beautiful site on the riverbanks, he has a situation where he has acres of land there on the river. And he thought it would be really nice if folks came to pick up food, according to the guidelines that restaurants are open for pickup and delivery. And he put tables out on the riverbank there and spaced them, obviously, having no problem spacing them far apart. And folks were coming in and picking up their food and going to those tables and eating their dinner. And they interviewed folks. They were saying, you know, at least we had hot food. We didn't have to take it home. It was a pleasant experience. And lo and behold, the state came and shut them down, or said that they could not do this. And if they continued to do it, they were going to lose their liquor license, which to a restaurant and a bar, obviously, that's the kiss of death. And again, a way of encouraging folks to do what you want them to do by threatening. So folks were actually going across the street to a park there, and the folks in Wrightsville Borough, the leadership there, who I think were also courageous and wanted to go another step, closed down the road, part of the road in front of the John Wright restaurant, and put tables out so that people could go there, saying that now it's not an infraction against Mr. Wright, or the owner of John Wright restaurant, but it was borough property where the tables were being placed. What I want to accomplish as a county commissioner here in Lebanon County is to give the folks in our county the same hope that the elected officials in Wrightsville gave that restaurant owner. And that's why I'll support this resolution.
Any other discussion before we vote?
Just a point of clarification again, Commissioner Phillips.
Yes.
The initial vote here would be on amending the motion. which again is adopting the resolution, and then there will be a second vote if this passes, then it actually votes on the resolution itself.
Thank you. All in favor of the amendment to the motion, please indicate by saying aye.
Aye.
Opposed?
Aye.
Motion carries. And so now we have a motion on the entire amended resolution.
Correct.
So we'll seek a motion for that.
I'll make a motion.
You
Oh,
had
I'm
a
sorry.
motion on the floor, didn't you?
I thought we did have a motion
Yes, you did.
originally.
We would just call for a vote at this time on the amended motion.
Okay. All in favor of the motion, please indicate by saying aye.
Aye.
Opposed?
Aye.
Okay, so moved.
I don't hear your votes. Are you voting?
Yes,
Did
I
you-
voted. Yeah.
No, Commissioner Phillips, I
Oh,
heard
I'm
him.
sorry.
I didn't hear him voting.
Aye.
I think it was simultaneous and one stepped over the other. So.
Sorry.
Okay. Well, thank you all for joining us and for being with us for this meeting. This is obviously a very difficult place that we're in right now, but we feel that we're moving in the right direction as far as the majority of us. And I will continue to run my office as doing the best that I can as I see it for Lebanon County, and I'm asking God to help me see what's right. So that's where I'm at. Thank you.
Thank you, Commissioner. Would you accept the motion to adjourn?
Yes, sir.
So moved.
God bless everyone and be safe. Second.
One bit of housekeeping, I will have an amended version of that, and we can post it on the county's webpage.
Thank you, everyone.
Thank you.
Thanks, Bob Dowd.
No problem.